I was still trying to absorb who this person was in this rehab center bed. This man with a doctorate in physics who could no longer tell time. And here is this woman telling me they're going to end his coverage in 2 weeks.
This is Gloria Bent, married to Gary Bent for 56 years. After emergency brain surgery, Gary's doctors had a recovery plan. The plan never happened. This is about why. This is a story about good intentions, predatory corporations, and an unaccountable bureaucracy. This is a story about Medicare Advantage.
It is neither Medicare nor is it an advantage. It is, I think, will be recognized in years to come as probably the biggest heist, the biggest fraud, the biggest transfer of wealth from taxpayers, middle income, low income Americans, from them to corporate executives.
For the first time in Medicare's history, over half of seniors now receive health insurance through private Advantage plans. Despite the name, Medicare Advantage isn't Medicare. It's for-profit health insurance with a great name. This means, without much of a debate, we've privatized one of the country's most popular social programs.
Let's take a step back to quickly explain how this happened.
After 20 years of fights, in 1965, LBJ signed Medicare into law. It's imperfect. There are real gaps around deductibles, out-of-pocket limits, and dental coverage. It also costs a lot. Medicare is one of the biggest items in the federal budget. So to save on costs, people started to look at how Medicare functions.
In 2003, the Bush administration created a bunch of subsidies and incentives for private insurance companies to compete with Medicare.
They called it Medicare Part C, or Medicare Advantage, even though it wasn't really Medicare.
It's functionally private insurance.
Advantage plans tout lower monthly premiums,
medical and prescription drug coverage for as low as a $0 monthly premium.
Cover services traditional Medicare doesn't.
Many offer prescription drug coverage.
Offer perks.
You can take advantage of a free gym membership.
Big insurers have now become some of the most profitable companies in America. One company decided to focus only on Advantage. Profit jumped 30%. By law, these plans are required to cover everything traditional Medicare covers, but that's not what's happening.
Instead, the government created a big pool of money,
sitting there for the taking.
And the bureaucracy health insurers built to take it has real human consequences.
He was an incredible dad. He was so many things to so many people. On Memorial Day of 2022, he woke up and he couldn't remember how to do things like tie his shoes or make eggs. They discovered that melanoma had returned.
He had a surgery to remove the lesion and to take care of the blood clot that had developed in his brain. He was not the person I knew when he came out of surgery. The physical therapist who was seeing him post-op, as well as his neurosurgeon, recommended that he go to a highly skilled rehab facility. We felt fortunate that one of the best, well, the best in the state of Connecticut had a bed for him and agreed to take him.
His transfer to a specialty rehab hospital was denied.
I just couldn't understand why my dad's neurosurgeon says he needs this care. The specialty hospital says we have a bed for him and we think we can help him, but somewhere along the lines, insurance just steps in and says, no, we don't think this is necessary.
Gary Bent did not have traditional Medicare. He didn't have a choice. He was an educator, a Connecticut state retiree. Budget cuts pushed all state retirees from Medicare to private Medicare Advantage plans.
Skilled nursing facility coverage is almost always covered in traditional Medicare.
Christine's job is to help Wisconsin seniors navigate the various federal benefits they're entitled to. She deals with Medicare and Advantage issues every day. There are a lot of differences between Medicare and Medicare Advantage. We won't go into them all.
But the relevant ones for Gary's story are managed care and prior authorization. Advantage is what the health insurance industry calls managed care. Medicare doesn't pay for services. Instead, it pays a flat fee per patient. With no financial incentive to push medical procedures, providers can take a more holistic and cheaper approach towards health. That's the idea. But it falls apart in practice with private insurance companies as a result of a process called prior authorization. Here, doctors need insurance companies' approval before they prescribe care.
The industry says it's a way to cut down on unnecessary medical expenses. This doesn't really exist in traditional Medicare, but it does with Advantage.
Insurers can use prior authorization to set treatment plans and override a patient's doctor. Despite the doctor's recommendations,
Gary was transferred to a short-term rehab facility.
The team there were all going to assess him and then come up with a care plan. And before that could even be finished, my mom received a call from an organization that we had never heard of called NaviHealth, telling us that my dad's projected discharge date was going to be in 2 weeks.
I pointed out that he was still being evaluated by the Seabury staff, and that in my initial conversation, I had been told to expect him to be there at least 2 months.
Think about that. The denial came before Gary was even evaluated by his care team.
And the NaviHealth representative's reaction was to laugh and say, oh, those physical therapists think they can cure everybody.
NaviHealth is a post-acute healthcare service provider.
They have an algorithm that uses a huge patient database to calculate probable outcomes.
These outcomes are supposed to inform doctors' decisions. There's nothing inherently wrong with that, but investigations have found that this data is less about informing a doctor's decision and more about denying care. In practice, Advantage plans have outsourced the pre-authorization and care decisions to companies like NaviHealth, who are using an algorithm to overrule treatment plans physicians prescribe for their patients. Individual circumstances don't really matter. The algorithm does. Gary's care team told them what to expect in the next few weeks. NaviHealth would deny care without notice. They'd have 24 hours to file an appeal. Then, another outside group called the Quality Improvement Organization would review the appeal.
They told me I would probably win 1 or 2, maybe even 3, but then the speed with which these denials came would increase. They would be fewer and fewer days apart, and eventually I was going to lose.
And that's what happened. Gary was denied care 3 times. His family filed 3 appeals. They won 2. There was no real rationale explained for any of the decisions. He had an option to appeal to an administrative judge. That meant more paperwork and a new level of financial risk.
It's then up to the patient to go back to all their therapists and say, can I have a documentation of every single treatment encounter that we had? It is hundreds of pages of records. About 1,300 pages was my biggest one yet.
Since the insurer denied the coverage, the family was now responsible for paying for everything out of pocket. They'd be reimbursed if they won, but that could be months, years down the line. And remember, unless they have family, patients have to navigate this process themselves. In Gary Bent's case, it would have been weeks after brain surgery. But if they're able to appeal, at the administrative judge level, the patient wins 75% of the time. That means that in 3 out of 4 cases, the care denials, 24-hour appeals, fighting an algorithm, gathering thousands of pages of documents, it should have never happened. The patients needed the care. And with these skilled care cases, basically none of them would have happened with traditional Medicare.
One of the big issues is we don't know the scope of the problem.
We know 75% of denials are overturned, but so many people never appeal. They rightfully give up. They don't want to fight a faceless bureaucracy set up against them, especially when it's in the last months of their loved ones' lives.
We felt like this process was designed to wear us out, and I would say it did wear us out.
We also don't know how much money insurers make off these Advantage denials. But the way the system works, there's a financial incentive for health insurers to deny care. The government pays Medicare Advantage providers a set amount per patient each year. Insurers get to keep a chunk of that savings if they spent less on the care than the government paid.
Compared to regular insurance, Advantage patients bring in double the gross profit margin. This is privatization in action.
The EMT who brought him home said that my dad felt like he had a low-grade fever. And I remember staying up through the night to monitor him. But in the very early morning, he was not responsive. He didn't know who we were. He didn't know where he was. And we called 911. What we've learned later was bacterial meningitis. He wasn't even home for 24 hours, maybe like 10 hours.
Gary went back to the hospital.
He was in the hospital for 3 weeks, and he lost all the progress he had made.
Eventually, Gary was released and went home. In spring of 2023, Gary Bent passed away, surrounded by his family.
This whole experience, it really opened my eyes, and I just can't understand how when someone is, in the sunset of their life, that they're having to go through all of this extra burden and hurdles that are unnecessary.
There was enormous stress in just having to fight for what he needed at the same time that we were watching his health fail drastically.
Medicare is a social system that was set up to actually provide care for folks. And Medicare Advantage, my understanding of it is that they work to deny your care to make profit. And one thing that has made a lasting impression on me is they're making these decisions and bringing money in hand over fist, and they robbed our family of things that you cannot put a price on. I would say don't sign up for it. It will not be there when you need it.
Thanks for watching. Like and subscribe to see more videos like this in the future. And as always, if you have ideas for future stories, go ahead and put them in the comments.